Hi, my name is Nidhi Sharma. I'm a women's health physical therapist here at FuncPhysio Physical Therapy. So today I'm talking about that first postpartum visit you get from your OBGYN after you give birth. I recently gave birth about 6 months ago, and I had the visit with my OBGYN which was very short, very quick, and she asked me only 2 questions. She asked me what did I plan to do about birth control, and she asked me if I was breastfeeding, and that's it. She didn't ask me any other questions and any other concerns that I might have. Now, statistics or research shows that up to 30% or 30 to 50% of women have leaking of pee after giving birth the first time, and 50 to 80% of women have leaking after the second time. So needless to say, there are definitely women who are having leaking, symptoms of pain, prolapse, leaking, back pain after giving birth, but they don't know how to seek help. They don't know how to bring this up to their OBGYNs. They don't know who to ask, and they don't know how to start their care for these symptoms. So this is a checklist of questions you should ask your OB when you go for your 6-week postpartum checkup. Okay? You're going to ask them, 1, did you have an episiotomy? Did you have a tear, whether it tore or they had to cut? If yes, what was the degree of it? Did you have an instrumental birth? Did they use a vacuum or forceps during delivery? If yes, which ones? Do you have prolapse? Is the organ coming down at all? If there is a prolapse, is it bladder? Is it rectum? Is it some other? Is it uterus? So you want to know, do they think you have a prolapse, and what is the grade of it? You should ask them if you're allowed to have intercourse, but also if you have pain with intercourse, what can you do about that pain? Okay, definitely bring up pain with intercourse, because unless you bring it up, you might think it's normal, while your doctor might have something else that you can do about it. After 6 to 8 weeks, when they tell you that you're clear to have intercourse, then you should bring it up if it's painful. And finally, please ask for a referral to a physical therapist, a pelvic floor physical therapist. Even if you're not leaking, you don't have prolapse, you're not hurting, it's a great way to get checked for pelvic floor weakness and to learn the exercises that will help you get back to your pre-pregnancy strength and hopefully prevent any problems in future pregnancies. Okay, so after asking all those questions, bring those answers to your pelvic floor physical therapist, and everyone who gives birth should at least get checked by a pelvic floor physical therapist once after giving birth to make sure your pelvic floor is in a good health, continues to improve, and you do not have any problems in this and coming pregnancies in future. Thank you.